I'm Sarah Wendell, Vice President of Clinical Strategies, and I'm here to talk to you today about a few simple strategies that we can use on a daily basis to help support our skill as highly educated clinicians. So if you follow these steps, you will be able to be very successful in supporting what you did and really differentiate yourself from what another professional could do. And that's really how we demonstrate our skill. Is going to be, how do we as PTOTSTs really show what we do is unique from, let's say, nursing or a personal trainer, an athletic trainer, CNA, any of these other professions that might be thought that maybe they could do what we're doing. We know that they can't. We have a different unique skill set, but we want to really show that every day in our documentation. So let's break it down and think about a few different ways we can accomplish this goal. So the first thing that we can do is describe in detail what we did as skilled therapists to help that patient. So thinking about our educating, our facilitating, all these different ING words that we use on a daily basis with our patients that we need to take credit for. How are we modifying what this particular patient is doing on a daily basis? So let's think about gait training for a second. So it would not be skilled if I, as a physical therapist, wrote patient ambulated 300 feet down hallway with contact guard assist and rolling walker. Anybody can do that. But for me as a physical therapist, if I start talking about all the manual facilitation I'm using at mid-stance to initiate the gluteus maximus and medius to facilitate an improved lateral and anterior weight shift, now we're talking about something that's completely different and very, very skilled. See the difference? I hope you do. Now, another thing that we can do to differentiate ourselves and really show that we are skilled clinicians is to be talking about our special skills. So I'm going to use manual therapy as an example. It's one of the things that we can do that really is one of our most evidence-based things, yet is so extremely underutilized. So if manual therapy, whether it be joint mobilizations or soft tissue mobilizations, is in your skill set, we want to first off, use them, but second off, we want to talk about them and explain exactly what we're doing and why. So for instance, if I had a patient with low back pain and I am doing PA mobilizations, I would want to be talking about what grade I was using them at. So maybe I was doing a grade 3. I'd want to talk about what I'm feeling. What does that joint feel? What did that joint mobilization accomplish? Did it help with range of motion or decreased pain? So if we can take these very special skills that we have and then show how we've had an instantaneous improvement in some of these areas, that is also going to be very helpful in documenting our skill. Now, the next thing that I think a lot of people struggle with is differentiating what we've done from one day to the next. So some of you out there look like you might be guilty of copying and pasting. So that's a big no-no. Again, even if a skilled clinician set up a program, it doesn't take a skilled clinician to do the same thing every day. I could train a CNA to do that. I'm sure you could as well. So we need to talk about how this treatment session is different than the last one. We need to show evidence that we are progressing, we are monitoring, we're seeing how that individual patient is responding and adjusting our treatment plan accordingly. So for instance, if we have somebody, let's say it's a shoulder pain patient that is having a lot of pain with overhead movement, we shouldn't just keep doing that or throw some modalities on. We need to examine that and determine that, oh, they have a shoulder impingement. We need to now do things differently and change up the exercises, change up our strategy. And we need to have evidence in our documentation that we're really analyzing and observing and adjusting what we're doing on a daily basis in response to our patients. So with those 3 specific strategies that should be pretty easy to do, I think you will all have much more success with documenting our skilled interventions. Thank you so much and have a great day.